Okay, good. Record is here. Okay, hello everyone again. Thanks for joining for our the second topic about determinants and indicators in public health and in health in general. So uh, I think in order to understand the public health issue, and importance of public health and how public health is wide and covering lots of institutional directions. This topic, the determinants, and especially one particular slide, is crucial and essential and one of the most important because if we stop the average non-professional, non-health professional people outside and ask them uh, what makes person healthy and what is the most important to keep and maintain health in general in the country, community, and personally, so that people can give us answer very, very differently. So let's start the our presentation. So let's go back uh, to previous topic about health determination, and let's analyze officially what health means. Okay, so the definition of health, we need to understand it very, very carefully. The World Health Organization finally agreed in 1948 about the definition of health, which I will read together with you, and then we can discuss about the definition and analyze this definition. The health is the state of complete physical, mental, and social well-being, and not merely the absence of diseases or infirmity. So, dear student, please pay very big attention of that essential and important and pillar determination of health. Because we will a lot of time during our course go back to this process, and we will many time I will ask you about health explanation. So let's analyze how World Health Organization and the world community understand the importance of health. The state of complete physical, mental, and social well-being. So what does it mean, guys? So that means that can we consider a healthy person who is not at the particular moment is not suffering with separate diseases or some particular diseases, but he is in a poverty line. So under the poverty line, the person who is feeding from the garbage and litter and is sleeping outside, being a homeless. So can we consider that kind of person as the okay, as the healthy person? But if we stop that person and ask, do you feel any pain, or do you feel any clinical? Do you have any clinical explanations? Uh, so that person in that particular moment can tell us that no, he is okay. Can we consider this kind of person as a healthy person? Can we consider also a healthy person, the person who is suffering with, working in an office in crazy, enormous workload, uh, and sleeping less, eating less, having only his or her, uh, you know, very, very high workload in any work, and not feeling himself happy or satisfied. Can we consider that person as a healthy person, or can we ask that person, do you have any health condition? Let's say like that. If we stop two kind of person, two kind of human being, one human being is the homeless or very poor, having lots of social needs, you know, but not having any clinical picture of having the diseases at the moment, clear clinical picture, and ask them. Uh, let's let's take that we do some questionnaire or checklist, and the one of the question is that do you have any health condition, any health problematic condition? What that person would say, the 99% maybe would say that they feel okay. They don't have a health condition at the moment. This kind of people, poor people. And on the other hand, also, we can ask another person who is, socially more or less okay, but, that person has a enormous and crazy high workload. So what can we do? What this person can tell us about his or her health condition. So also he will tell us that he is okay. But based on this definition, what you see right now, none of these two different people we cannot consider the healthy person. They are not healthy based on definition of World Health Organization, based on definition of world community. What means being a healthy? That is clearly shown in that definition, what you see right now, that the health is considered as a complete physical, mental, and social well-being. What does it mean? The thing what we focus about the clinical picture, or do they feel any pain or something like that, is a physical exposition of health. But another thing is a mental exposition of health. And mental exposition of health, it doesn't mean that if the person has a mental disorder which is visible. And another exposition of health is a social well-being. Imagine, so the being somebody poor and being somebody satisfied with his minimal social needs is directly related with health condition. It's strange, if you see something. Somebody can be poor, but can be healthy. You would say maybe, I don't know, but think. And there is clearly also shown that social well-being, and not merely the absence of diseases or infirmity, absence of diseases only doesn't mean that you are healthy. And now let's answer the question, why? Why social status? and social well-being has so high and place here and direct connection with the definition whether we can consider person healthy or not healthy. So the very simply say, it means that, uh, and why we start with it, because we must understand that meaning of being a health very, very wide. And it does not mean only, and it does not narrow with the pain or absence of diseases. So, and if the meaning of health very big and very wide, the public health also the meaning of public health and the world which public health is covering, it's also very big and very wide. Let's go back to a simple example. There's somebody who is homeless, sleeping in the street and feeding from the garbage litter or something like that. Where this way of living can bring this person or can lead this person to go in 1 year, in 2 years, where this person, if he continues to live like that, will go finally. Of course, with diseases. Of course, that person will have some of them very soon, some of them in a mid level, it doesn't matter. They will have different diseases. Unhealthy feeding, unhealthy life, unhealthy condition, unhealthy environment, everything unhealthy around him because he is very poor in social need. Of course, that will create the enormous disease environment around him and he will become unhealthy very soon. The same we can say with a person who is suffering with enormous workload. Of course, this enormous workload will lead him to depression, will lead him to mental disorders. That means, people, my dear students, that unhealthy life, if it caused with if it's caused based on social and environmental and life conditions, and if the people are under the influence of these unhealthy condition, will make them will make them unhealthy, will make them sick, you know, and that is why that if the person has an absence of diseases in that particular time, when we ask him, but live in the unhealthy condition, mean that based on World Health Organization and agreement of world humanity and society. So we cannot consider this person as a healthy person. Something is not okay. Something is very much not okay. So, and if the nation are in total poverty, if the nation are in total unhealthy condition, that a total country, total nation, total rural area or community will have a big problem with a lot of people. So this is another very, very important slide. I would say one of the most important slide in our course, because here you should break your understanding, with about meaning of and influence of hospitals and influence in health organizations towards to maintain health for people and for personal. What do you see here? The question is very simple. What makes us healthy and what makes us sick? If we stop still average people, average citizen, non-professional, and ask them, dear citizen, can you tell me what government in your country must develop and improve the most to maintain your health, your family health? What we need, simply say, to be healthy. The vast majority, because there's a lot of researches are done about it, the vast majority automatically will answer you. So they need good healthcare system. They need good hospitals. They need good clinics. And in that way, with good healthcare system, but healthcare system is a little bit different and a little bit wider. But with good hospitals, good clinics, and things, we can be healthy. But that is mistake. Please see percentage of influence of health. 48, 50%, half is a social and economic condition. What does it mean? Not hospital. Good social and economic condition will make us healthy, and bad social and economic condition in 50% will make us sick or will be a source of diseases. Another 22% is the environment. I mean a physical environment, the water, the air pollution, and all of the things related to physical environment, and also the people's lifestyle, behavioral environment. You know, it's also very important. I mean, how I live, if I smoke, if I drink, if I follow unhealthy lifestyle. Another 80%, it's a genetical influence, which is also stronger on our health. And only, guys, 12, maximum 40% in the clinics and hospitals. Only in 12% hospitals and clinics can influence on our health positively. And absence of hospitals and clinics can influence on our health negatively. Only in 12, maximum 40%, and in that 12 and 40%, primary care is included. Primary care, it's ambulatory, early diagnostics. So what does it mean? Almost more than 80%, 80, more than 80%, on our health can be influenced social and economic condition, environmental condition, and genetical condition. What does it mean? How do you think, guys? That means that public health is more than hospitals and clinics. Much, much more than hospitals and clinics. And another case, another very good example with current situation, current condition, what we have now related with coronavirus pandemic. Which kind of institutions are mostly involved in the process to stop pandemic? Stop pandemic, not treatment of people. Whole governmental body, police, military, law limitations, and all institutions, all ministries. And only, and of course, the public health institutions, which has a leading role, epidemiologists, and so on, but this is not, clinics and hospitals. And if the pandemic explosion happens, what happens in Europe and United States, which kind of picture you see in your daily news? Can clinics and hospitals manage this process? No. Clinics and hospitals cannot stop pandemic. Clinic and hospital can only try to treat sick people in their ICUs and other divisions to not die, to somehow stop this process. But in order to catch chain of contagion, chain of spreading of disease, chain of spreading of infection, which institutions are the most important? The cooperative working of whole governmental body, and all limitations. Because, what's happened in coronavirus, in current world, is that even in very developed countries, very high rich countries having a very strong, hospitals and clinics and healthcare systems, they cannot stand, they cannot manage this coronavirus pandemic, and they are sending people, if they don't need the oxygen therapy, if they are not very, if they are not under the very heavy health condition, needing not only oxygen therapy, but only the help of ICU, other things, they are sending the people at home because they are not able, the hospitals and clinics in their 12% of influence are not able to manage the process. On the other hand, they are focused towards the treatment. But we are saying that we stop. Why this breakdown and lockdowns in a house are happening and stay at home? That has only one very clear reason: to help health system not be stuck, not be overloaded. I'm pretty sure you have heard in your daily news some of the theory that the 70% and more than 30% of world population finally will get coronavirus pandemic. But our most idea and the goal is to prevent this process, to manage the process portion, piece by piece, in order to avoid absolute destroying and stocking of health institutions, the hospitals. So what they are saying to us, very simply say, they're saying to us that we try, that you get coronavirus piece by piece, the amount by amount, to help health institutions, the clinics and hospitals to serve you. So this is one theory. Because we don't have vaccination, the vaccine, and it will not come along. And also we don't have a treatment medicine, even the exact treatment plan, unfortunately. And we talked in our previous lecture that some things related how this, created exposure of coronavirus pandemic and what is the role. Even let's take Korea, Japan, Singapore, the Eastern countries successful with struggle against coronavirus. What their action is their action to focus all money during this world pandemic to make us stronger, to maintain and rise the hospital beds only. No, all their effort mostly are focused on another actions, which is not directly related to health institutions. Social distancing, strong limitation, police and military limitation to cut and break this chain of contagion first, and then they serve these people with diseases, with sick people, uh, piece by piece. And this is about communicable diseases and in an epidemic situation and in infection communicable diseases. But also, this is a lot of non-communicable diseases which still remains the first killer. The cardiovascular diseases, diabetes, and so on. How these diseases appear? This is very important question. Accidentally comes to us as a destiny, or it's a result of our lifestyle with wide meaning. How we live, which kind of society we build, and which kind of environment we make around us, and which kind of social condition we improve. Of course, all kind of diseases, it's a result of our action. Absolutely. So why I'm saying a lot, stopping on that slide, because guys, you should understand that public health is not a science directly and fully related with health organization, clinics and hospitals, and only diseases. Because as we remember from previous lecture, the function of public health is the most important, I would say, is a prevention. To prevent the diseases not to happen, or happen in very few amount and very few percentage. And if we want to prevent diseases, so we must open our eyes and our, analyze much more wider and realize that if we want to achieve good health in our country, in our community, the lifelong learning, and there is a different map in the world. Yes, I think you know what I mean under the different map in the world. I mean the life expectancy. how long the people can live in a different countries. So, highest life expectancy. Do you know where is it? It's in Japan, average 80 years, average. The shortest life expectancy, Sub-Saharan Africa, 50 years. It means a person averaging, he is 14, 35, it's under the high risk to die. So, and this different map in the world in life expectancy is one of the health indicator. Now go to next slide. What health indicator means? So, what health indicator means? The health indicator, simply say, dear students, is that the measurement point of some tools which show you how healthy this or that particular community is. For example, let's say you want to go in a country, Burundi, let's say, somewhere on Belize, okay? So, and you were asked just write a short report how strong health system in that Belize is, which health system they have, and how healthy the population of Belize are. How you can investigate and guess and write your report to analyze and assess health status of Belize people. So you should use different and several tools to see some numbers or how healthy Japan people are. So, and life expectancy at birth, how long the people live, is one of the health indicator. If you see the short life, long living in the country, this is the one signal, one tool, one data showing you a health condition and status of that people. And also, simultaneously, alongside with it, health system. Because if people live 50 years average and die in their 40 years, of course, there is no any health system in that country. So, health indicators are the tools with which we can measure health status of the community and population as well. So, with the goal of good health in mind, think of an indicator as the measure that helps quality and the achievement of a goal. This is Mark Friedman. Mark Friedman is very famous after of public health. Then we will talk about Mark Friedman, the Avedis Donabedian, and other key figures in health, and others who invented the vaccinations, antibiotics. It's important, but later on. And now let's say, how can we find this health indicator and what makes a good indicator? So one of the important things that we need data power. We need, let's say, not about the country. You need to investigation the region of your country, a community of your country, the health status, health condition of the community of your country. You should do a research investigation because you're a health worker and then you need to go or you need to build, you need to build a hospital. So new hospital, you have a project of new hospital, and you need to understand what kind of health need that people have. But before you go deeper, you need to understand generally health status of that people. So you need a health indicator. And in that health indicator, and you need to have a good data. So data power is very important. So, and the communication power to create a good research and uh, collect the data power. Now the basis of health indicators. So what we have here, explanation that health indicators are based upon conceptual models for what influences health status based upon scientific research. What we talked about 5 minutes ago. Uh, for example, in the beginning of 20th century, the leading causes of death were pneumonia, tuberculosis, and diarrhea, and erythria that compared to heart diseases, cancer, stroke in 2006. What do we have here? So we have here so that the first killer for population in the beginning of 20th century was the infection things, the pneumonia, uh, the tuberculosis, the diarrhea earlier than 20th century, the Black Plague, and so on. But based on vaccination, based on invention of antibiotics, based on very effective involvement of public health action, those infections get back and non-communicable diseases comes around. But as I told in my communicable, like heart diseases, cancer, stroke, and so on, those diseases become the first killers for world society. But as I told you, this presentation and book are, are published before coronavirus pandemic. And as I told in my previous first lecture, everything will be changed because in some point, the world society thought that infection diseases is not so aggressive threats, at least for developed world like Europe and United States. And Corona took everything turned inside out. And they still work, think, but nobody knows how to even treat that virus. But still, my dear students, health indicator, let's say the pneumonia, tuberculosis, and diarrhea was one of the cause of death of the people at the beginning of 20th century, which can be considered as one of the indicators. Now about the importance of health indicator. What I told you, the health indicators help to determine health status of community at a particular time. Oh yes, time is very important. Not generally, but in that particular time. By health indicators, we can compare health status of different communities as a particular point of time, health status of a community and different times. So what does it mean? The explanation is very simple, I think. The explanation is simple that by health indicators, by some tools, we can compare health system and health status of neighborhood countries or two different regions, and then we can analyze what that particular region of country do correct, and they have better health status, or what they did wrong and what they need to improve. So, and healthcare needs of community, resource allocation, and so on. Now we have another important issue, the terminology. It's a determinant of health. There is always question, and also you will have a question in your exams, the difference of health indicators and determinant of health, because some people think that they are same. What do you see in your slideshow is that determinant of health emphasizes as physical environment, social environment, and health behaviors. Okay, let's say if life expectancy, how long people live, is one of the health indicator, how good health system or how healthy they are, the determinant of health is that showing you the picture that which kind of environment they live, which kind of social system they live, how they live, health behavior. They all smoke, drink, or follow the physically active, clear lifestyle. So that is the most important difference between the health indicators and health determinants. Health determinant itself, the determinant is determines the things which makes people sick or healthy, like environment, like social condition, like their own life behavioral. But health indicators is a tool, is an assessment tool by which you can assess health condition of those people. I think it's now and the life determinant, social determinant, and so on. It exists. How are health indicators used? Powerful indicators are powerful tools for monitoring and communicating critical information about population health. I told you about that. Indicators are used to support planning, identify priorities, develop and target resources, identify benchmarks, and track progress toward broad community objectives. It's the same. So you can, when I provide an example about the research and building a new hospital to learn the health status of society, it's the same. Health indicators can help you to plan your health action or one of particular society to assess their health system. Engagement of partners in foreign policy, it's not something important. Who complies health indicator, reports and complies every judicial LA, state and local level, health determinants from the center. Okay, now health indicators. Mortality indicators generally. So mortality indicators is one tool to see the death of the people, because the mortality indicator is one of the strongest indicator of health status of community or society. Infant mortality rate, IMR. Please remember these things, this slide. Infant mortality rate. Guys, just very simple question. If in your area, let's say in any area, There is a lots of infants are dying. What do you think? Do they have a good healthcare system, or do they have a good health? Of course not, because the children and infants are most vulnerable, and all the things which is going wrong towards the health is directly reflected to babies and infant. So if the country has high infant mortality rate, it means that they have a problem, very big problem in their health. The maternal mortality rate ratio, the mothers, we will explain later on what mother means. It's a special terminology. It's a pregnant woman or woman having the children. If there is a high mortality rate of pregnant women, of course it's a problem, and we can and it's you know it will be reflected and reported with numbers. It's everything countable, the special number of infant mortality rate in that country, number of mother mortality ratio in that country, under 5 years old mortality rate. Do you see that we have 1, 2, 3, 4, 5, 6 mortality indicators, as 3 of them are related to mothers and children health. Why? Because I'm again repeating that the children, infants, and mothers are the most vulnerable and touchy sort of society. And if something goes wrong in our health system, that directly reflected to the children's health. And children are the most important, and babies are the most important, because those are our future. And that's why the health system and public health take so much importance and focus to mothers and children's health. And if you have a low number, high numbers of mortality of under the 5 years old and the infant and mothers, of course it shows that the health system is destroyed, or the nation have a very big problem. Another one is accrued death rate, disease-specific mortality rate. What the disease-specific mortality rate means, that which kind of diseases are first killer in that country. Infection diseases, the cardiovascular diseases, or which kind of diseases and in which percentage. And proportional mortality rate, it's also important. It's proportional mortality rates. It's a mortality rates based on age and based on proportion to diseases. So this is all. If you need to investigate the mortality indicator, the general health status, of course, but the mortality indicators, which is the first tool to see the health status of society, you see these 5. You ask these 5 numbers, and then you can simply analyze and realize health status that particular or another health society. Morbidity indicators, the same. Incidence, prevalence, notification rate, admission and discharge rates in various health facilities. So this is the incidence and the prevalence is a terminology which we will go later on, but now simply say that incidence and prevalence, it means that the numbers of cases. So notification rate is that how these numbers are reported and investigated. So admission and discharge rates in various health facilities is the same. The health facilities in the hospitals, clinics, ambulatories, how it can be discharged and admission. And proportional disease-specific morbidity, it's the same as proportional mortality rate, but more, disease-specific mortality rate, but more deeper, because in that particular way in the disease-specific mortality rate, we investigate the diseases which kills. But in that particular way, professional disease-specific morbidity investigate a little bit different. And absence from school of workplace, that's not important. Disability rate, oh, this is also important. Number of days of reduced activity in a population. If you go deeper to see the number of days in bed in the hospitals. If investigating the health system, if we see that there is a long bed hospital bed load of population, you can simply guess that there is wrong treatment and wrong health system in terms of treatment of, in terms of hospital system that particular country has. So number of work days lost, what is also, it's a different numbers when you do a different investigation and research. It means that there is some statistic in developed countries that if person suffers of chronic diseases a lot of time, and if the somebody citizen 6 months in a year is out of work, so, and if the country has a lot of people like that, of course they have big problem in treatment or maybe management of chronic diseases or something like that. But those number will tell you the way, then show you the way where to go more deeper and what you want to investigate. So nutritional status as an indicator, that's very important thing, because bad nutrition is a source of a lot of diseases, and source can be a source of poison, that can be a source of lots of disasters. So prevalence means it's kind of percentage number comparison of low birth weight. Low birth weight means that less than 2.5 kilogram in a birth, it's a big problem. It means that mothers and children's health is under the threat. We know to analyze that mother and children's health is under the threat, we don't need only investigation their death until their, if you remember the first mortality indicators, that infant mortality rate, IMR of maternal mortality. Only these numbers are not these numbers, of course, is very crystal clear picture. But before we go to the death, or we lead to the death, we need to investigate these problems. Measurement of height, weight, and mid arm, and so on. What does it mean? North Korea, the very simple example. The people in South Korea and in North Korea are absolutely same. But people in North Korea are smaller, several centimeters, and their weight, general weight, are less of 8 or 10 kilos of several, or 7, I don't remember exactly, because it's a result of bad living, public health, and a health condition. So comparing with South Korea population. Life expectation. As I told you, my first example was life expectancy of birth, expectation of life free of disability. Yes. So what does it mean? The second one. Somebody can live there 60 years or 70 years. It's also possible in now modern healthcare. But all his life, he can suffer with chronic diseases and be very expensive for his government. So free of disability life. How long? that particular person, that particular people, that particular focus of society live without chronic and another starting another cardiovascular and other chronic diseases. So it's also important number. Now health facility indicators. We also can indicate health facility, so hospitals, clinics, based on several data. Doctor population ratio. How many doctor that particular country, region, does not matter, the city, has in 100,000 population. Another, if there is a less number, they have a problem. So doctor-nurse ratio, it's very important. How many doctors and how many nurses? So the average standard of doctor-nurse ratio is for per doctor is 4 nurses. Do you know the numbers of Georgia? Ratio of doctors and nurses? The one on the one doctor, 0.8 nurses, even not one. That's a big problem, big problem. Health worker population ratio, not only doctors, but generally doctors, nurses, and other health institutional workers, public health workers, and the population ratio. Population hospital bed ratio, how many hospital bed has this particular population. It's also counted in 100,000 people. Population per healthcare center, and so on and so on. And with this number, you can assess generally the health facility and which kind of hospitals they have. So environmental health indicators, proportion of population having access to safe water supply at home or 15 minutes, walking distance. So you can smile on it maybe, but this is big problem for more than 2 billion people in the worldwide. More than 2 billion people in the worldwide. It's a problem to access of clear water. And that problem, my dear student, is causing the aggressive infection diseases. It's one of them. Or the problem of excess of water, excess of clean water is, I think very soon will be one of the first problem for worldwide public health, and the competition on that particular things will be very high, rather than comparing with oil competition earlier. So proportion of population having access to safe sanitation. So sanitation, there is no doubt, there is no any discussion, is the first reason of infection diseases. And not only, unfortunately, infection diseases, but the first. And sanitation facilities at home, or we know that we will see the important number later on when we will discuss about the diseases and about the epidemiology, that people are, the over 1 billion or something like that, over, I don't remember exactly, but the very big amount of world population are in open sanitation and open defecation, which is very big problem. And another environmental health indicator. So when we see these things, the air pollution and so on and so on. Social and mental health indicator, the road traffic accidents, suicide, homicide, drug and alcohol abuse, smoking, gender violence. It's very simple thing to see the numbers, and then we see the social health status here. So and socioeconomic indicators related to health, population growth rate, per capita gross national product, which is economic thing, and you can ask, this is economic indicator, but as we already agreed that social and economic status is one of the important for public health, and it's 50% social and economic bad social and economic condition can make us sick and can cause the diseases. Unemployment rate, literacy, especially female literacy rate, the education, and so on. So health policy indicators, what we have here, political commitment for Millennium Development Goals, and allocation of health sectors. Yes, actually it's over. Now let's go back to our presentation, and let's again remember this picture. If I ask you what we need to care of and maintain, so you should remember social, economic, environmental, genetic proportion on our health, and only 12% of health organization. It means that the public health, and in terms of public health, it's a crucial, important, and public health is very wide rather than clinics and health institutions. So, and another things we need to remember, the difference between health indicators and health determinants. Now I am stop sharing my screen. Just okay. And now I'm ready to see your questions. Okay, I see the the question right there. Please, can you explain the health determinants again? Okay. So I'm pretty sure we talked about a lot about the health indicators, and you understand the health. I just want to show you the difference between health indicators and determinants, and in that way you will remember it's better. The health indicators is a status. Health indicators is a tool you can assess health status of society, people, even the health institutions, even the clinics, and so on and so on. But the health determinants, let me to share for you again my screen. Just a moment. Again, my screen. And it will help you to understand better. This one. Okay, what do you see here? The determinants of health emphasizes physical environment, social environment, health behavior. So let's see. The based on indicator of health, we can count of numbers of death rate, of mortal IMR, mortality of infants, mortality of 5 years old children. You see the numbers, and if the numbers is high, you can see that's a problem. But determinant of health is the things what determined their death, what caused their death, what's a problem. It's a bad physical environment. The mother was a smoker, and that there is a high percentage of smoker mothers, and because smoker pregnant women, and that just because that high mortality of infant, or there is a total poverty social environment condition determines this number of indicators, or it's a bad behavioral condition, as I told you about the smokers. What is the causing, which environment caused these numbers? This is the health determinant. What determines these health indicators? Okay, another question. Let me to see the questions. We see, please. Okay, this is. Can you speak a bit louder? I was loud, I think. I'm always loud. Just about the physical body that makes someone healthy. Yes, it's a comment. Homeless person may have anxiety and depression due to their situation. You are right. The homeless person can have anxiety, and they can have both the mental and the social, and of course, it's not be considered as a healthy. Complete physical, complete mental, and complete well-being. So, comments I see. Remove the little white box at the bottom of your. So you're saying none of it is due to chance of bad luck as well? Okay, I explained health determinant. Could you please upload the PowerPoint for the lecture? Thank you. The PowerPoints, dear students, upload it in your drive. Come on. You will find it in the drive. Okay, all the questions is on. And thank you for your attention, my dear students, and good luck for next meeting. Bye-bye.